If you're watching this video, you probably sprained your ankle and you're wondering, what should I do? I'm your dual licensed sports chiropractor and certified athletic trainer, and I'm going to walk you through step by step from the beginning of the time that you sprain your ankle all the way to you're walking normal again without any pain. Before we get started, please like and subscribe, and don't forget to ring the bell so that you get notified when we make more videos on how to help you guys get out of pain fast. So today I'm going to break down this video in 5 sections. The first is, when should you get an X-ray? The second is, should you ice or should you heat? The third is, should you be wearing an ankle brace or using crutches or get a boot? The fourth is going to be, what can you do today so you can accelerate your healing process? And finally, what's the best rehab exercise that you can do at home so you don't sprain your ankle again? So let's talk about the first thing you should do if you sprain your ankle and you're debating, should I get an X-ray or go to the urgent care or even perhaps the emergency room? So first, let's talk about whether you need to get an X-ray or not. Now, this is following the Ottawa ankle rule. The Ottawa ankle rule, which I'm going to show you, is a simple rule to determine whether you need a foot X-ray or perhaps an ankle X-ray. Now, most ankle sprains are going to be an inversion ankle sprain, which means that the toes are going to roll that way and your ankle is going to roll in. Now, very frequently will it go out that way. It's possible, but most people are going to be rolling their ankle this way. Now, when that happens, you're going to check a few areas within your ankle/foot. So first, the lateral malleolus, which is just the outside ankle bone, the bone that sticks out. Press on the backside from the bottom and 6 centimeters up on the backside of that fibula. Now, if that is tender, note it. You're going to check, same thing, on the inside medial malleolus. Now, that's another big word just for that inside ankle bone that sticks out. You're going to press on that backside and all the way up 6 centimeters just to see if you can locate any tenderness. Now, note that as well. After, you're going to try and take 4 to 6 steps. Now, if you can do that with minimal discomfort, you probably don't need to get an ankle X-ray. Now, let's move on to the foot. We're going to press on that highest arch point, which is going to be the navicular bone. Now, if you feel around the inside arch, you're going to feel a little bone sticking out. Now, you're going to press on that and see if it's tender. You're going to note it again. You're going to go on the outside. This is called the base of the fifth. This is your pinky toe now. So you're going to press from the pinky toe and then all the way to this base where it kind of dips a little bit. Now press on that end of that bone. Is it tender? Again, note it. After you note either tenderness, walk again for 4 to 6 steps. If you can do that with minimal discomfort and no tenderness, you probably don't need an X-ray. Now, if you do have tenderness on this point, the outside bone or the inside bone right here on the ankle, and you can't take 4 to 6 steps, then most likely you either need a foot X-ray or an ankle X-ray. And that is the Ottawa ankle rule that many doctors will use to determine whether you need to get an X-ray or not. The next common question is, should you ice or should you heat? Now, we're going to use a time frame for this as our guide. So the first 0 to 72 hours, so about 3 days, we want to ice as much as possible. Now, how often or how much is too much? The ideal rule is about 15 to 20 minutes every hour as needed. So that's a general guideline that I tell my patients and my athletes after they sprain their ankle. First 0 to 72 hours, ice for about 15 to 20 minutes every hour as needed. And most likely during that time, you would want to do some sort of compression to minimize the inflammation. Now, when you ice, there are things that I would recommend. Now, again, this is what I tell my patients. It's not something that you have to follow. Always ask your healthcare professional. Now, when people come in, sprained ankle, completely swollen, the most important thing to do is to move it. And you have to do this safely. Now, back in the day, they used to say, oh, you should, don't move it, don't bear weight, completely rest. The RICE, which is rest, ice, compression, and elevation, which is not necessarily false, but there's a better way. And that better way is you want slow movement. The best way to do this with minimal pain and discomfort is to dip your foot, your entire ankle, in an ice bucket. That way you can decrease the inflammation, numb it up, and then you want to do ABCs. What that means is you're going to use your big toe and you're going to draw A, B, C, all the way to Z. Now, this is going to help just to get that range of motion slowly to move again in a safe and controlled manner, using the ice to decrease the pain and the discomfort. Now, this is very important because when we immobilize the ankle too long, the recovery process takes a lot longer. Now, so the best thing is to move it as soon as possible with what you can handle. Now, this is a very gray area, so always ask your healthcare professional. So let's talk about heat. When should you use heat? Well, my recommendation is if it's an acute ankle sprain, which means you just rolled your ankle, you probably should just stay away from heat, unless you're in that rehab phase. So in general, my recommendation is acute ankle sprain. What should I do? You should ice. Moving on to the next section of talking about when to use compression sleeves, boots, ankle braces, or even crutches. Let's dive into this together. Now, this guide is going to tell you minor, moderate, and severe ankle sprains. So how do you even determine if it's minor, moderate, and severe? Now, this is very hard because you have to ask a healthcare professional. But if I'm generally speaking, you can look at your ankle. If it's really swollen, it's probably not minor. So if it's minor, it has minimal swelling, minimal bruising, and you have that range of motion still, that you're able to move your ankle. If that's the case, then a compression sleeve or an ankle brace will be just enough. However, if it's moderate, what does moderate mean? If there's moderate swelling and there's moderate ecchymosis, or if there's bruising around and you can't move your ankle too much, then perhaps that time you will most likely need an ankle brace, which is going to help to support it more. If you're unable to walk or bear weight on the injured side, then perhaps you will need a boot or even crutches to take that pressure off, and so you can rest and heal it a little bit better. So if you were able to rule out an ankle fracture with getting the X-rays or the Ottawa ankle rules, but you still need to wear a boot or use crutches, then remember that section that we talked about right before. We want to move it as soon as possible. So make sure that you don't rely on the boot or the crutches, but in fact you slowly start to bear weight, walk on it, get the range of motion back, because that is going to help accelerate your healing. So we made it to part 4. What's gonna help to accelerate your healing process for your ankle sprain? Well, the most important thing is you have to control inflammation. So the best way to take care of inflammation is going to be a few things. Compression sleeves. Sometimes you need ibuprofen, which is an NSAID and an anti-inflammatory. Sometimes you can do effleurage massage to flush the inflammation out. When you flush your inflammation out, make sure you go from the toes and back to the heart. You always want to flush towards the heart. That's going to help to drain the lymphatic system and reduce the inflammation. Some key supplements that might help include turmeric, garlic, magnesium, fish oil. All of these supplements can help to not only reduce your inflammation, reduce the pain, and help to accelerate your healing process. Now, once you control that inflammation, the second most important thing is that you move it safely. Now, how do you move it safely? We talked about the ice bucket and the ABCs. Now, once you're comfortable, you don't need the ice bucket. You can just do the ABCs in the air. Things like mini squats will even help. Calf raises, going up on your toes and down. Just small movements that are safe and controlled will help to accelerate your healing process. And finally, we made it to the 5th section. And if you made it this far, now this is the most important part technically, because you want to prevent that ankle sprain that you just had from happening again and again and making this a chronic issue. So all you have to do is these 3 recommended exercises, which include a light stretch, ankle strengthening, and a balance exercise. These 3 things can often prevent a lot of ankle sprains. And finally, here's a simple and easy calf stretch that you can do to help to get that range of motion back. Again, if you feel unstable, you can go ahead and hold the wall just like this. But always focus on that back ankle and make sure that the heels are down. Here's an easy 4-way band stretch using a resistance band to strengthen your ankles. First, we're gonna bring our band right above our toes and we're gonna focus on pointing our toes down. You're gonna do this for 10 reps, a total of 3 sets. Now, once you finish that, you're gonna angle your band in so you can push your ankle out, just like that. You're gonna do the same thing for 10 reps for 3 sets. Once we finish the outside, we're gonna pull our band out and point our toes in, same thing. 10 reps for 3 sets. For the last direction, you're gonna hook a band under something that's stable so that you can wrap it around your big toe and you're gonna pull that band towards your face. Again, you're gonna do this for 10 reps for 3 sets. And these are the 4 directions that you want to do using this resistance band to help strengthen your ankle so that you can prevent future ankle sprains. Now we're gonna do a balance exercise that's going to help to increase the stability of your ankle. We're gonna use the affected side. So if you sprained your right ankle, you're gonna stand on that right side, and then you're gonna use your opposite leg to do toe taps behind, forward, side, and side. Now keep that right leg nice and planted, and you're gonna repeat that again. Now we're going to do this for a total of 8 reps and a total of 4 sets. And because this is preventative, you want to do both sides. If you found value to this video, please like and subscribe and help support our channel. I hope you take care of that ankle of yours. Aloha.